Bismillah, alhamdulillah, wa salatu wa salam ala rasulullah. Welcome everybody and welcome my colleagues Dr. Ahmed Al-Sheikh, Dr. Muhammad Al-Fayoumi and Dr. Ahmed Al-Gamal, Dr. Islam Abu Yusuf. Actually, we are very happy to meet you at this session. Actually, it is a continuation of the series that we started last week, just to ensure that we cover all the related tools or quality tools that will be appropriate to be used during such epidemic. We started by general thoughts about quality role in the quality professionals role in the COVID-19, and then we went through the tool WHO checklist, and we addressed some quality tools that can be used easily and appropriately. This session is focusing on the lean and the applications of lean tools in the COVID-19 pandemic. We have Dr. Muhammad Fayoumi will start our presentation, but we need just to add a poll for you to get some thoughts about your experience with the lean. So we will start by it. It will take almost okay. It will take 1 minute only. The result of this poll is actually 55% of the respondents are beginners, and we have 27% intermediate, and we have 9% are experts. So it's a good start actually. So we will start. I'll give the mic to my colleague Dr. Muhammad Fayoumi to start talking about lean concept.
Okay. Assalamu alaikum. Shukran, Dr. Mustafa. Thank you, Dr. Mustafa, for the introduction. Okay, today we will talk about the application of lean tools during the COVID-19 pandemic. And I think the first question that we might ask, do we need improvement during this pandemic? احنا فاضيين للكلام ده؟ ايه رأيكم؟ You can answer in chat. Actually, the improvement or using the lean tool for improvement is really indeed needed. Not to add a burden on the staff, not to exhaust the staff, but we need to help the staff and make their life easier. Okay, so that's why we need improvement during this pandemic to help our staff. And why we are talking about lean tool and Kaizen? Because Kaizen gives us 4 main advantages. First, it is learning environment. It is an interactive improvement using the staff idea and their contribution to make improvements. Also, it uses a quick burst. So you can have quick wins and you can improve processes really fast. And it is somehow of steady improvement. As I said, you are using the staff ideas and you are dealing with real problems and real concerns of the staff. So as long as the staff are sharing actively in this, you can have a steady improvement. And also it is a change mechanism for the whole organization, that the organization can use it to change the mind of the staff to focus on how they are working, to focus on improving their work, and to change their mind to make sure that every step they are doing is leading to an improvement and reducing waste. So to start with the Kaizen steps, next slide, please. So the stages of Kaizen. Kaizen is a Japanese word that means change to better, to make a better work environment, to make a better process that doesn't contain any waste. So these 10 steps are mainly summarized in the 3G, what they call the 3G, which is Gemba, Genputsu, and Genjutsu. You know, during the last two sessions, we had some confusion about to talk in Arabic, to talk in English. So we decided in this session to talk in Japanese. I think you are all familiar with this. So it's Gemba, Genputsu, Genjutsu. Next slide. No, I'm kidding. Okay, Gemba is the real place. So to start Kaizen, you need to go to the real place. You need to go to the place where the work is done and start gathering ideas. Then Genputsu is real parts. As you know, that this started in Toyota, and they were talking about parts of the cars and so on. So the parts in healthcare here we are talking about the steps of the process. The steps of each process is considered as our parts that we can work with it and improve it. And Genjutsu is the real statistics. What was the status before? What was the status after? What was the data that you need to collect to know your current status? And what is the data that you need to collect to make sure that you already made an improvement? So the 10 steps that you look at the document reality, what is the real situation now? Then identify waste. And here you can look at the 8 wastes of lean, which is transportation, inventory, motion, overproduction, overprocessing, waiting time, and defects. And of course, the unused skills. So you need to look at these wastes and identify wastes in each process, and then plan countermeasure to remove this waste, eliminate this waste. Reality check, where you check the reality and the real situation, make changes to improve this, and then verify these changes. If these changes are really will improve the process, measure the results and see if there is any improvement you have done, and make this as a standard, celebrate your success, then do it again. So this is the 10 stages that you need to go through to start a Kaizen improvement. Next slide, please. Dr. Ahmed. And during the COVID-19 pandemic, also need to find a way to keep improving performance for the most critical process. So you may think of a fast way of improvement, which we may call short Kaizen. And we are using this in our hospital to make sure that we are making improvement really fast. It's like fast forwarding. When you are hearing a track, you need to fast forward this track. This is the main idea of short Kaizen, that we will reduce these 10 steps into only 4 steps. Next, please. These 4 steps will start by collecting concerns from the process owner. And you need to go to the areas, and the most critical areas by now is the emergency room, the visual triage area in the emergency room, the ICUs, and so on. You can go to these places and start collecting concerns of the staff. What are the most important problems that they are facing every day? And then accordingly, you can prioritize your initiative. You will get 10, 20, 30 initiatives according to the staff concerns. Start prioritizing these initiatives with the staff, see what is the most important for them. Then you can use the Kaizen card, which we will talk about it in the next slide. In this Kaizen card, you start using them for documenting improvement, and then document improvement in this Kaizen card. Next slide, please, to go through the Kaizen card. So the Kaizen card, this is an example. In the before Kaizen, you put pictures or graphs about the data you collected about this concern. Let's say you are improving the track of patients through the visual triage. So you can here start collecting some data about how much time does it take to have the visual triage done, how much time does it take to transfer the patient to the flu clinic or to the isolation room according to the visual triage score, and so on. Then start in the problem. You write the problem that you may have a long time. You may have a gush of patients that you can do visual triage for everyone, and so on. Then think about the implemented item. And during this idea, look for the staff suggestions. Usually they have a very nice suggestion, but need someone to hear from them and implement them and put the results. And again, in the after Kaizen square, you can put here data which was improved, or even pictures. If you are using 5S, we will go through these details. And this will document your improvement before and after. Make the staff proud about it. Let them write their names there. Put pictures for them in the Kaizen card, and even you can do it as a poster and put it in the board for in this area to make them proud about the improvements they have done. Okay. So this is for the introduction for the main tools that we will use. Then we can show you, next please. This matrix, we developed this matrix to suggest to you what tools that can be used in according to the WHO hospital preparedness checklist that we went through last session. As you can see in the column, there are 7 selected tools that we will go through in details in this session, which are the value stream mapping, the visual aids, the poka yoke, Chiduka, spaghetti diagram, 5S, and just in time. And you can see that, for example, in instance management system, you can use the value stream mapping to draw the process itself, and you can, according to this, identify the team members and how they can work. You can use the visual aids in the form of cards or action cards to make sure that they are using it. In surge capacity, for example, you can use also value stream mapping to map the process and how to deal with the patient in surge capacity. You can use visual aids to show the pathways. Also, you can use Chiduka to make the staff raise their concerns and so on. So this matrix will help you just give you suggestions about what tool to be used if you are applying this WHO checklist. Next slide. In this matrix, it is the same tools, but we suggested the use of them during the SPEC model, which we discussed in the first session, which is contain the role of quality professional during COVID pandemic regarding standard compliance, performance improvements, emergency preparedness, and communication. And also you can see in this matrix that we suggest in which function you can use the tools that we will go through in details today. Thank you now, and we will go through the first tool with Dr. Ahmed Al-Gamal, but first we will have a poll.
Thank you, Dr. Muhammad. Again, in each step or each tool, we would like you to just give us some thoughts about your experience. So the next tool will be value stream mapping. So I launched a poll for you just to get some thoughts about your experience. So, and the results are 48% are beginners, 33% are intermediate, and we have 4% are experts. So this is good to start. Dr. Ahmed Al-Jamal.
Okay, thank you very much, Dr. Mustafa. Assalamu alaikum, everyone. I would like to go through the value stream map. So please, if you can flip the slide, please. Yeah, thank you. So it's only one slide here talking about value stream map. And as you could see during this session, we are not really teaching how to do the tools, but we are just touching on the tools and trying to find a place where you can fit in the tools during the current pandemic. So value stream map, when you talk about value stream map, it's basically helping you. It's a tool that can help you identifying what kinds of waste you have in your processes. And for waste, you have this definition of non-value added steps. Steps that are in your process that does not add any value to the patient. So when you look at a pandemic, people rushing into a hospital or into a healthcare system, trying to find a medication or treatment for their case, with a lot of panic, with a lot of emotional stress. You don't really want these people to waste their time waiting for something. You need to increase the value of the time they are spending looking at or receiving your services. So when you look at this graph that we have here, when you look at each box represents a step in the journey of a patient coming to your hospital or coming to your healthcare system and trying to find a way their treatment. So probably you have a GP system in your city or in your country, where a patient tries to go first to the GP, for instance, with this COVID-19, complaining of something like headache or something like fever. And the GP can then send the patient to a hospital. The patient might not be registered in the hospital, so he needs to spend some time doing registration. Then someone will do the triage for the patient. Then someone will give the patient the treatment. Then someone is going to discharge the patient after care. If you look at each step of these and find out how long does it take one average patient to receive the care, to meet the doctor and the nurse, or to get the medication. These are the value times for the patient. Anything else, where the patient is just waiting, doing nothing, waiting for someone to come, someone to be free enough to give them some sort of support or some sort of care, this is not value added. If you came to know the pathway of your patients in each step during their journey, the COVID-19 patients, during their journey to and through and out of your hospital, you will be able to identify what are the value added steps and leverage on them, and what are the non-value added steps and try to eliminate and lean them out. Doing this will help you a lot to avoid unnecessary motion of the patient at the hospital and probably a spread of infection. It helps you to correct any mistakes in your process. It helps you to avoid any waitings. It helps you to provide faster care to those patients. So as I said, we are not really discussing or explaining each single tool, but this is a tool that would help you with your journey with the patients of COVID-19. If you used it this way, if you followed up the pathway, the flow of the patient, and identified the value-added steps and leveraged on them. Thank you, Dr. Ahmed. Next slide.
Dr. Okay, thank you, Dr. Ahmed Al-Jamal. You will continue with us, but before you will start just-in-time tool, we would like also to ask our candidates just to to give us again some thoughts about their experience with that. So it will take only 1 minute. Okay, so the results are 46% are beginners, 32 intermediate, and almost 7% are experts. So, Dr. Ahmed.
Okay, thank you very much. So for just-in-time, what just-in-time means? It means that you don't stock or you don't store a lot of supplies waiting for the production or for the service you are providing. You keep the demand pulling your supply. So you keep your supplies elastic enough to be driven by the demand. And we saw actually a lot of examples of this during this COVID-19, where you see some hospitals prepared on-call doctors, lists of on-call doctors that can help in providing the service when there's a need. So when there's a gush of patients or a gush of family, a big number of family members coming together because they all started to feel the symptoms of COVID-19 and come to the ER. You have a list of those doctors that can jump in the ER when needed and start to provide care just in time. Another example is that we saw multiple healthcare facilities moving towards on-call teleconsultations. The good thing about on-call teleconsultations is that they are also just in time. You might not keep the patient waiting till the next morning or till the next time you have available slot in your clinic, especially that many clinics are already shut down. So you can just allow them to have the consultation from their physicians, their required specialties, from their requested specialties when needed. We have also another example, which is COVID-19 hotlines. So you can see, you can have a hotline just dedicated for COVID-19. Even if you have long list or long queue of patients asking for appointments or for advices, medical advices, you can fast track the patients who are asking for their COVID-19 advices by having a specific IVR line. Finally, here I would like to add an example of building capacity of non-ICU doctors, having doctors in different specialties trained on how to do ventilation thing, how to do the care for COVID-19, what is the case definition, what is the progress, how shall they treat the patients, what is the guideline. Then you can have those people you can have those staff available just in time you need them. Next slide, please. Hello? Yes, thank you. So I also kept here some examples where you can see on the left side, you can have a full package of all the PPEs lumped together in one bag, just kept beside the patient or beside the patient room. So doctors and nurses just in time can find them when they go to check the patient. I saw some hospitals who are having this cabinet in the middle where it's installed just between the rooms. So doctors do not need to go in and out trying to find out the masks or gloves. They can find it directly on the cabinet. On the right side, you can see the mask dispensers or even the gel dispensers, which is a common practice everywhere. Yet it's part of the just-in-time culture that you can build in your hospital. Thank you very much.
So thank you, Dr. Ahmed, for giving some thoughts about just-in-time. So the next tool will be poka yoke. So before we will start, again, we need your answer for this poll. Let's start, 1 minute.
Assalamu alaikum wa rahmatullahi wa barakatuh.
Assalamu alaikum, Islam. 1 minute, we'll finish the poll and you can start.
Okay, poka yoke, the concept.
Islam, we run the poll and the result are the level of experience of our candidates are ranging between 40% as beginner, 24% as intermediate, and we have 16% of our audience are expert in poka yoke. So let's start discussing it.
Oh, excellent. Okay, thank you. Okay, I will go quickly to talk about poka yoke. Poka yoke concept, or the concept of poka yoke, or foolproofing, error proofing, or mistake proofing, has been around for many years, such as electric plugs, floppy disks. These are very famous examples of poka yoke. But the Japanese industrial engineer of Toyota, Dr. Shigeo Shingo, who was most prominent and influential person in developing the poka yoke into a technique for error proofing in industry, and then it is transferred to healthcare. In poka yoke, we look at our processes. So if we have a process, there may be some mistakes, and if these mistakes happen, there may be some defects. So poka yoke is either prevention-based poka yoke or detection-based poka yoke. Prevention-based poka yoke is in the phase before conducting mistakes, to prevent mistakes actually, and detection-based poka yoke is after mistakes are happening to detect these mistakes to prevent the defects from reaching the customer. So poka yoke is either prevention-based or detection-based. Examples for detection-based poka yoke, such as pop-ups with while you use CPOE, computer physician order entry in electronic records in hospital information systems. So when you have pop-ups, saying this is overdose, or the patient is allergic to this or whatsoever. So these are pop-ups to alarm you from what you just ordered. This is detection-based poka-yoke. Also, those physicians or nurses with IDs, with statement written on the ID stating that did you wash your hands the patient. العيانين اللي بتطلب من العيانين انهم يسالوا الدكتور او الممرضه او الكير جيفر انت غسلت ايدك قبل ما did you wash your hands. These are also detection based poka-yoke. If he or she did not wash her or his hands, he go back or she goes back to wash his or her hands. Prevention based poka-yoke there are a lot of examples in healthcare. For example, in the COVID-19 times, we hear about specific hospitals for isolation. This is poka-yoke. It's a way to prevent transmission of infection. So you put all the infected patients with COVID-19 in one hospital to prevent spread of infection. When you design your workflow in your hospital, which is not, for example, an isolation hospital, when you unify the patient flow and put a triage tent in this flow, so any patient who want to go for a hospital must go through this triage tent for respiratory triage. This is also a way to prevent missing cases with respiratory problems or with COVID-19 or suspected cases for COVID-19. So triage tents are example for poka-yoke also, prevention-based poka-yoke. Alcohol or sanitizers or hand sanitizers dispensers outside each patient room. It's a way to, it's also a strategy of poka-yoke to prevent having patients, caregivers seeking or looking for those sanitizers and not finding any of them, so they neglect to wash their hands. Actually, it also reminds them with hand hygiene. So it's also a prevention-based poka-yoke. Other strategies for poka-yoke in COVID-19 and in healthcare in general, like access control for isolation rooms and access control for ICUs, critical care units. Access control here could be electronic access control, so it's prevention-based poka-yoke also. And it could be as simple as a security guy, security officer, sitting or standing in front of the isolation room or the critical care area to control who is allowed to enter this area. So this is also poka-yoke. It's prevention-based and detection-based on the same time. Also, examples also for poka-yoke, such as medical gases in critical care areas in OR. You cannot you cannot connect oxygen into vacuum or into you cannot connect oxygen into nitrous oxide or vice versa, because simply it's designed only to be connected to the right connection. So this is also forcing function, one of the poka-yoke strategies. While you use other nurses who are less trained to be ICU nurses and staff in ICU in the surge of COVID-19, you may face the problems that I heard about in the real life, that for example, a nurse can inject oral medication, a syringe of oral medication for a child into a venous line or central line. It's a disaster to do this. But how can you use poka-yoke in this? Simply by getting oral medication syringes. Oral medication syringes are not this way you prevent injecting oral medications in IV lines, particularly by less experienced ICU nurses and non-ICU nurses. It is not fitting in the cannula. You cannot fit it in a cannula. All these are strategies for poka yoke in healthcare. Also, I heard from one of the air quality engineers a couple of months ago that they found that some of the HEPA filters, the air quality filters, in one of the good hospitals in the Gulf region, that these filters are upside down. They found the filters upside down, not perfectly positioned in their place, upside down. So they were not working actually. You can use poka yoke here when you select your the design of your HEPA filtration system and your air system in your hospital. To have these filters, only you can put them in the right direction, the right way. This is also poka yoke. Thank you, and if you have any questions, it will be my pleasure to answer.
Thank you, Dr. Islam. I feel that this presentation is almost Japanese, as Dr. Muhammad said, but as all of us know that lean concept is very evident in industry, and we hope that the tools can help us to facilitate, as Dr. Muhammad Fayumi said, the work of our staff. Using poka yoke is one of the powerful interventions that may help us to control some of the errors may happen with dealing with cases, as Dr. Islam said. So talking about poka yoke will give us opportunity to go to the following tool, which is Jidoka, and thanks for my colleagues that they gave me such a very easy tool to pronounce and a very easy tool to even talk about, but we will try together to get some insight about it. So just to start as usual with our pool about Jidoka. 1 minute. So the result is we have 49% are beginners, 14% are intermediate, and 6% are expert. And I think that 31% has no clue with that. And this is so special for me. So I have the opportunity to talk about it, and we will introduce such a concept to our colleagues here. It's a tool. Again, it's a full proofing, and it is almost equal to poka yoke, but it has another arm. As you see in this slide, if we have a process made manually by a human, we can start to inject some of the steps using the machine instead of the human, and the human can start to control the machine whenever it will go anything go wrong. He can stop the machine immediately. The last step, which is using andon light or andon cord, it is we will make the most of the steps are using machine, and then we will where the machine itself has like control parameters. Whenever anything in a step will go wrong, it will stop automatically. So it is almost using the word automation, that we will automate the process, but with some human touch, with human control. So we the message I received from my colleague was very evident for me. I hope you can hear it. It's from Dr. Mohammed Al-Fayoumi. Actually, it is like a very emotional message from my colleague, describing himself using, not using Jidoka, but he was like a step or a tool in this methodology. So what we need to say about it, it is mainly 4 steps. You need to identify the errors in each step. You need to make it stop or respond to every abnormality. Separate machine work from human work as much as you can. Enable machines to detect abnormalities and stop automatically, and assure quality for everything by confirming the outcome for every process. So it is like, again, separation between the human part and machine part, and using control in each step. If anything will go wrong, you need to stop the process. Next slide, please. So how we can use it during COVID-19, we came up with some ideas about it. One of them already used a long time ago in one of the famous hospitals in USA. Actually, they did something called safety inspectors. It's like staff empowerment for all of their staff. They will work as Jidoka. They can stop the line whenever they see any abnormality. So it is our time now to increase our staff empowerment during this COVID-19. So you can just tell every and each staff in the ER, in isolation room, in patient wards, whenever you see something wrong, you see your colleague not wearing properly the PPEs, you see something going wrong in the ER, you see a flux of infectious patients, whatever you want, whatever you can set for them as a criteria, you can tell them clearly. You can stop the line to ensure that all staff are safe, and also the patient is safe from any kind of error. So the first intervention is to make everybody in your process as a safety inspector, and he can stop the line by empowerment from the leaders in every and each place in your hospital. The second point was, I think most of you are familiar with it, especially in Saudi Arabia. We have a standard addressing isolation room, and we require all hospitals to have not only the monitor, but the monitor has an audio or alarm. So whenever the pressure or the air cycles became abnormal, the alarm will go on, and accordingly somebody should fix it, and the process should go back to normal. Another thing that we may use in some scenarios also, the red light in some rooms. Whenever we have, for example, a patient with the infectious disease, we can it can be visual aid, and also it can be Jidoka. So whenever we have an infectious case in a room, we can alarm this in a way or another. Again, if there is alarm for visual triage door whenever the door is opened, and as again all of you know that the visual triage or the visual waiting area standard mandate that this door should be closed all the time. So whenever we have this door open, there is alarm will go on and the staff can fix it immediately. The other thing, no PPEs if we don't have PPEs. And actually I agree, I know that we have this problem in some hospitals, but again, staff safety is crucial here. So using lean concept, including prioritization of who should use what, and accordingly you can you can implement the Jidoka by saying that whenever we do have this kind of shortage in some areas, we need to stop the line as much as we can. So this is like the tool that I hope it became more clear for some of our colleagues here, and I hope it will help us to reduce errors for our patients during such epidemic. But again, I need to state again the statement of Dr. Ahmed Sheikh that we are not in emergency. So it is like pandemic. We need to take care of our patients, and we need to take care of ourselves to keep ourselves safe as much as we can. So thank you for listening to Jidoka, and we will go for the next slide, which is spaghetti diagram, Dr. Mohammed Fayoumi, but we need your thoughts about the tool and how experienced you are with. So let's start. So we will end the poll. Actually, we had a problem with this poll. Sorry, Dr. Mohammed Fayoumi, because we got only one answer, which is intermediate. So, so you have only one audience, Dr. Mohammed, maybe.
Okay, Dr. Mustafa, welcome again. Thank you, Dr. Mustafa. So for the spaghetti diagram, it is a very useful tool during this pandemic, and of course, during normal times. The spaghetti diagram simply is concerned with waste related to motion. So to construct a spaghetti diagram, you need to get the layout of the areas that you want to do spaghetti diagram in it. Let's say you are doing it in one of the wards, and accordingly, you start by the layout. Then you can set with your staff and start having a different color for each staff movement, and ask him how is he working, or how he's moving during normal working days, and start drawing lines starting from his start point to each point. So let's say that we have a nurse, she go into the ward, then go to the locker, she changes to the scrub suit, then she went to the nurse station, then from nurse station she can start going to each area, each room. So you can just draw this. She can go to get some supplies from the store and come back. She responds to the codes and so on. Then you can do this for each nurse and do it for each physician, and set with them again after you draw this and see how waste is going on. If you can look at the right side of the slide, you can see an example from NHS, and I put in the chat a link to this nice guide. It's only 4 pages to construct and use a spaghetti diagram to improve movement and reduce waste. So you can see here in the red dot is the places of the staff, and all the red lines are considered as waste movements that you don't need. So you can use this in, for example, in the visual triage and ER areas. And in this area, you can draw on this layout in the spaghetti diagram. You can also draw the patient's movement. So the patient, when he comes from the door to the visual triage station, then to the flu clinic or to the isolation room or to regular ER pathway, and see how the patient is moving. You can find many waste movements that can spread infection and delay the patient care. So you can delete this from the movement and make sure that the patient is moving right, and also your staff is moving with the least waste you can. You can do this also in ICU area, which is usually a crowded area. And you know that we may have patients with multiple specialties caring for him. And accordingly, you also need to organize how the patients are moving in this area. Also, you can use this in the isolated patient transfer. You know that you should limit the transfer of the patient or transport of the patient inside the hospital. Maybe your patient need to make an MRI and you need to transport him. Accordingly, you need to draw this spaghetti diagram to make sure that the patient is moving with the least movement, passing by at the minimum number of departments and passing by the least number of staff. Also, you can use the spaghetti diagram to draw the line how the lab specimen is moving in the hospital to make sure that it is reaching the lab in the right time and the results are coming back in the right time. This is very important areas that you can use the spaghetti diagram in it. It may look like a difficult tool to use, but it is, once you start using it, it is very easy and you can do it very simple one, and you will be surprised by the amount of improvement you can do using this tool.
Thank you, Dr. Muhammad. Actually, it is so difficult in comparison with Chidoka, actually. Thank you for this. It is very simple, as you said, and I think it will help a lot. So we will go forward with the next tool, which is 5S. And as usual, we need to see how what is your experience with using 5S. So I launched the poll. It is launched already. So I hope to get some answers for Dr. Muhammad for this time. I think it is running, so I don't know what is the problem with the pool. It is not appearing for some people, so is it appearing for our audience? Not me. So we will try to help as much as we can. So we have only one answer again, Dr. Muhammad, but if you can give us your answer in the chat for the time being till we will see what is the problem with this. So okay, so it is like it will not work for the time being again. So Dr. Muhammad, you can start with
okay, thank you, Dr. Mustafa. So for the 5S is mainly used to organize the workplace. Also, we have another use for it, using it for documents, but Dr. Ahmed Al-Sheikh will talk about this in details. So we will focus now on the main use of 5S in organizing your workplace. So 5S is a very easy tool. It contains 5 steps starting by S. It's clear. And the steps are sort, set in order, shine, standardize, and sustain. So starting by sort, and this is the most important part of the project when you are doing 5S. In sort, you start categorizing all the tools around you into some categories, like I use it all the time, I use it once daily, I use it twice daily, I use it once a week, I use it once a month, and so on. So you make a table. We will show it in the next slide. And this table, you start categorizing these all the materials and tools around you and sort them accordingly. Then you go to the next step, which is set an order. And in set an order, you start rearranging your workplace according to the list you have made in the first step. So what you are using frequently all the time, keep it as much near to you as you can. If you are using, for example, the PPE all the time in the visual triage area, keep it on the top of your desk, and so on. Whatever you are not using this frequent, you can put it in the drawer, and whatever you are using, let's say, for example, weekly, you can put it in the store of the department. Whatever you're using once monthly, you can just transfer it to the hospital store. You don't need it in your area, and so on. After you do this set an order or sorting, you shine the place. You make sure that everything in place. You make sure that everything is clean. Then you can go to the fourth step, which is standardize. You start putting labels and visual aids. Dr. Ahmed will talk more about visual aids. And you can put these labels on the drawers, putting on it what is in this drawer. And you can put these labels on the desk, on top of your desk, but make sure that it can be cleaned so the infection control people will not be mad with you. To make sure that everything will be in its place after you make this project. At last, the sustain step, and in the sustain step, you just make sure that what you have done is sustainable. You can make audits to make sure that the labels in place, everything is in its place according to the tables we have done. And you can start auditing this every day, then you can do it every week when everything is sustained. Example to do this where you can do it in the visual triage desk. So you can help the staff to make their life easier so they can find whatever they want without any hassle or confusion. You can do this in the nurse stations, and most of us know that it can be messy with their workload, but it will help them a lot to save time. Also, it will be very helpful in the stores, whatever in the department stores or in the hospital store, in the lab. And I'll show you an example from one of the labs in hospital in Egypt. Also, it can be very helpful for physicians and nurses in examination room, while they can reach different forms easily and not searching for these forms. Remember also, it is every second counts. And the main aim for this is to make sure that you are making it very clear and you can save time by it. Next, please. So this is an example from one of the hospitals in Egypt. So you can see on the left, this is the categorizing or the sorting table. We started by whatever is used daily in hematology, in chemistry, in bacteriology. They just listed the tools they are using, whatever that they are using weekly and whatever they are using monthly. And you can see on the right, the pictures before and after, how we made the visual aids and how we make the labels to make sure that everything is sustained and clean and easy to reach. Thank you.
Thank you, Dr. Muhammad. We will continue with Dr. Ahmed Ahmed Al-Sheikh for visual aids, and but we will try to run the poll for this as we can. So I hope it will appear to you. Okay, it's working for this. Maybe the problem is Dr. Mohammed Fayoumi, maybe.
Thank you.
The results are we have 41% are intermediate, and 29% are beginners, and 16% are experts. So you have a challenge, Dr. Ahmed, because you have like a good percentages are experts. Dr. Ahmed Sheikh.
Assalamu alaikum. I hope my voice is clear. Okay, so that's great, because visual aids is something that we are living with. Maybe that the term itself is a little bit confusing, but the practice, it is there. Every single example, every example that you see here is an example that you can implement in your hospital, but actually in real life, you have a lot of visual aids. You remember the traffic lights? It's a type of visual aids. So every time you're trying to set a nudge, something you're using the visual signs in order to make people easier to detect what should they do, what should they don't, is a sort of visual aid. What you see to the left, to the up left, is directing people to leave some space for those who are getting out from the elevator and those who are getting in. To the bottom, you will find that these places are, this is what we call a nudge. You're nudging people to stop on these signs, on these footsteps, in order to make sure that there is a good space. This is what we call the social distancing. You can implement it is really highly advised to implement this as a recommendation from WHO in the pandemic of COVID-19. The same here you will find in the top right. You are trying to distance the queue. So you have a long queue, so you should set a space between each one in the queue. So in order to tell them, you can keep shouting, they will not listen. You can post some wordy signage, they will not read. But if you put a simple nudge, something that when they see, they understand that they should abide to this, this is called visual aid. Another example that I left to the last of the slide is the tracks that we set for every type of our patients. I believe this implemented worldwide, at least if you do not have it in your hospital, you saw it somewhere, because you simply, instead of getting someone to guide your patients to go through the process, which patient is going where, I mean, the red category, the green category, the yellow category, and so on. If you're following the Canadian triage in the ER, and that's very important, they are going to follow this track. Some hospitals started to set a new track for the patients. Remember, we're talking about the COVID-19. If this patient is suspected or this patient is facing some issues with the respiratory symptoms, they are going to follow the yellow, the purple, whatsoever. Let's debate on the colors. But by the end of the day, you have a track for this. ببساطة شديدة بتحط لهم بعض العلامات على الأرض يقدروا إن هم يفهموا منها المريض اللي عنده مشاكل في الريسبيراتوري، بما ان احنا بنتكلم عن كوفيد، يقدر يتحرك مباشره للمكان بتاعه من غير اي مشاكل، او تحط فود ستيبس زي اللي انتم شايفينها دي تقدر تباعد ما بين الناس عشان تقدر تحافظ على التباعد المجتمعي. صوره ابلغ من 1000 كلمه. So a picture worth more than 1000 words. And remember that there is a quote back to Benjamin Franklin says that just tell me and I'll forget, show me and I will remember. So it is more impressive to show people what to do. This is an example from my hospital in one of the KAIZEN projects. The problem was the newly joining team to the CSSD had an issue with using the instruments and just compiling the instruments into kits. So we took the permission from the IPC and we utilized simple tapes, simple color tapes in order to create color code. It became very easily not to rehearse from a very lengthy list, just to collect the colors. Is this only applicable to the workplace? Let me introduce to you a tool that we created or a methodology that we created, and we called it vitalization. A question to you is it important right now to follow guidelines, to follow policies? The problem is if we assume that we are in an emergency, so do we have time to read the policies? Do we have time to read the papers? The problem is no, they don't have time. So it's your role as quality to energize these documents, to add energy or life to these documents. And this is what we called vitalization. This term is our term. We published this back in 2017, me and two of my dear colleagues, Dr. Imam and Ms. Sultan Al-Sharif. And this is published in a paper called Bridging the Gap Between Documents and Practice, and it's called document vitalization. Very simply, do not depend on these lengthy, bulky policies. People will forget. Create something very simple for them. Create a flow chart, create a poster, create a video, create a nudge, create a visual aid. Out of these, it is very easy to remember. And the most important advice, if I can advise you to have, is put these at the place of the implementation. So for example, when you're trying to remind those on the visual triage station on the steps that they should do, put the poster there, put it clearly there. Do not make one poster for the whole process. We see this a lot. Split it into every single point of contact. So if you would like to make a vitalized document, it should be self-explanatory. It should be summarized as much as you can. It should be easy. It should be user-friendly. It should be redundant-free. It should be error-free, and should be time-saving. One very important advice, do not make it on your desk. Get the real team in the bus and start working on it. The tool this tool, the problem is what to vitalize, which documents to start from. The tools that we hear, and by the way, you can implement this to all the tools as long as I'm the last speaker or the final speaker. So you can implement this, prioritize, try to make a prioritization matrix for your processes, for your documents, for whatsoever. Just enlisted the green part. In the red part, just prioritize using the high risk, high volume, problem prone, whatsoever of other elements or other criteria that you would like to implement. Give it a score from 5 to the most favorable, 1 to the least favorable, multiply it, and you will get the top. This is the problem. This is the biggest problem that you need to work on. This is the busiest place that you need to work on, or this is the most important document that you need to vitalize. One of the tools, we have several tools to implement the vitalization. Let me introduce to you this one of the oldest that we used to have at the time that we had paper-based OVR form. Okay, so Dr. Fayumi, thanks to him, he explained the concept of 5S. Does it only applicable to the workplace? The answer is no. It can be applied even to the process steps, and here you will see that it is applicable to the documents. This wordy, lengthy form, you can shift it from to just using the 5S. Start by sorting. The red, get rid of it. The yellow is for modification, and the green, this is only what I need. Then red tag, remove what you don't want, keep what you want, set it in order, put it in order of the implementation, a step by step, and then color coded, a visual aid in order to make it easy. Every single part is color coded. And finally, this is the standardized release. This is the before, this is the after. A document that's following the process, not a document that's following what you wrote. One final example, if you think that you are in an emergency, you are not in an emergency more than the team in the code blue. They are saving life. There is a patient that's gasping, and they are intervening just to make sure that this patient, inshallah, hopefully to return back to normal. So this is one of the vitalized documents. It is there to help the code blue team to be reminded with the rules. You will find here who is the team, position of each team member during that time, and the rules of each team member. The same, by the way, those who are following us for the third time, we talked about the action card. This part is the action card, the team leader. This is the action card of the team leader. What should he do? So think of something like that. Think of something that follow back to what Dr. Fayumi was telling us about the spaghetti diagram. Think of something that's visual, that is displaying the whole process in your ER for the patient that is for the COVID pathway. And just write very simple sentences in each stage. So what should this patient have in the visual triage part? The patient in the isolation room, when the patient moves from to, make sure that there is an alarm. Again, this is what Dr. Ghalwash said in the Jidoka, there should be an alarm. This patient is being transferred to the imaging or transferring to the ward and so on. So combining all these, you're going to have very good tools that can help you to implement the improvement, and will help you a lot with your process. I have one question to you before you start your questions. I will try to answer the question of my colleague Dr. Fayumi when he started. Does it work to save only 1 minute using any of these tools? Does it work? You can answer in the chat. Does it work? What if I tell you that we're going to save only 1 minute? Only 1 minute. Does it work? Okay, let's do this calculation on your own. If you save 1 minute for a process that you do only 5 times per day, then if your colleagues are doing this process, you're going to end up with 1,500 minutes saved every single day. We're not counting waste, we're not counting resources, we're counting lives, and these lives are depending on us. Thank you so much. I'm done.
Thank you, Dr. Ahmed, for this comprehensive presentation about visual aids, and by this we will conclude, but we have a request just to summarize the whole presentation in Arabic, and I'll do like 5 minutes just to recap, not summarization but recapping of what we said. انا هتكلم بس على يعني يا ريت كل السبيكرز يبقوا معايا كمان بالصوت لو حد عايز يتدخل. احنا الفكره كانت كلها ان احنا بنحاول نستخدم الكواليتي تولز في وقتها وفي مكانها، على اساس ان احنا نساعد الزملاء سواء كانوا الانفكشن كنترول او الدكاتره الاطباء او النيرسز في عملهم، مش نعمل نوع من انواع الربكه او الكونفيوجن او البيردن او نضيف عليهم بعض المهام. فلما اتكلمنا اول محاضره اتكلمنا عامه عن دور الكواليتي، وبعدين بدانا نتكلم شويه عن ال WHO تشيك ليست ودور الكواليتي في ان هو يسهلها عليهم ويعمل communication plan و other plans that will help them including وكمان الخطط الثانيه اللي ممكن تساعدهم اللي هي زي الاوديت plans و other tools. جينا على اهم تول احنا شايفين يمكن زملائي كلهم زي ما الدكتور احمد نهى محاضرته من اهم التولز اللي ممكن تسيف ولو دقيقه واحده في كل بروسيس احنا بنعمله. والبروسيس ده لو اتعمل 100 مره في اليوم معناه ان احنا we saved 100 دقيقه. اعتقد مش بس دقيقه واحده، احنا لو استخدمنا different tools بتاعت اللين سواء كانت فيجوال ايدز اللي هي الفيجوال ايدز دي الحاجه اللي انا هبتدي بالاخر. الفيجوال ايدز دي الحاجه اللي احنا بسهوله الستاف كان سيت وريكوجنايز ات ويستخدمها على طول من غير ما يقعد يدور عليها او يدور على الباث واي اللي يمشي فيه او الفورم اللي ممكن يستخدمه. انتوا عارفين ان في الامرجنسيز زي مثلا الكود بلو او الحاجات اللي هي بتحتاج سرعه، محتاجين فور اكزامبل ناخد دواء معين او نستخدم فورم معين. لو تصوروا ان مفيش الوان او مش عارفين نميز، ده معناه ان انت تاخد وقت كتير عشان تدور على الحاجه عشان توصل لها. ففي الواي اللي هي ال5S والفيجوال ايدز الدكتور احمد والدكتور محمد عملوا زي تجميع عليها على اساس ان احنا نقدر نسهل نعدل الورك بليس او المكان اللي بنشتغل فيه، او حتى الدوكيومنتس او اللي هي السياسات والاجراءات، بان احنا نوصل بطريقه سهله للامبورتنت او الحاجات المهمه في وقتها وبسرعه من غير ما نقعد ندور. في حاجات تانية اتكلمنا عنها زي البوكا يوكي اللي هي تول بتمنع الخطأ أصلا. يعني لو حصل خطأ البروسيس بيوقف تماما، أو حصل خطأ أو ما بيسمحش أصلا بأن الإنسان يغلط. يعني ما بيسمحش أصلا بالإنسان يغلط، يعني ما فيش إلا وان باث واي هيدخل فيه. زي مثلا عندنا في الترياج دلوقتي أو الإمرجنسي عندنا بابين، في باب فيهم في الفيجوال ترياج. لو سيبنا البابين مفتوحين يعني في 50% من الناس ممكن تدخل من الباب من غير ما يتعمل لها فيجوال ترياج. يبقى نعمل ايه؟ نقفل الباب الثاني، معناها ان خلاص انت قفلت، يعني يو فورسد الناس او دفعت الناس انها تروح للباب واحد. فده واحد من البوكا يوك او الحاجات اللي احنا بنستخدمها. منها مثلا دكتور يعني في امثله كتير بس مش عايز لان الوقت كده هيعدي مننا. اتكلمنا على الاذر تولز زي انا كنت على الفيجوال ايدز وال5S واتكلمت على البوكا يوك. ايه تاني اتكلمنا عنه عشان بس فكروني يا شباب؟
انا شايف سؤال
سباكيتي دياجرام، في طلب كبير على سباكيتي دياجرام.
السباكيتي دياجرام واحد من الحاجات اللي انت بتعرف ترسم بيها كتير الموفمنتس اللي بتحصل في اليونت سواء كانت في الطوارئ او في الجيرشي روم، وبتعرف منها تقدر تخطط ايه الحتة البيزي والحتة النوت بيزي او الحتة المهمة والحتة النون مهمة، وتقدر تقلل كتير عن الناس الورك لود او الضغط اللي بيحصل عليهم، بالاخص لو كان في حاجات بيحتاجوها وبعيده عنهم وبيضطروا يلفوا في المكان اللي بيشتغلوا فيه عشان يوصلوا لها يعني. من التولز اللي استعملناها كمان اللي هي الفاليو ستريم مابينج او الفي اس ام. الفاليو ستريم مابينج دي من الحاجات القويه جدا اللي احنا بنستعملها كمان لما نكون عايزين نعرف ايه الخطوات المهمه وايه الخطوات الغير مهمه في اي بروسيس بنعمله. لو انت عملت الكالكوليشن دي هتلاقي كتير من الخطوات اللي انت بتعملها في كتير من البروسيسز ممكن الاستغناء عنها. لو بنتكلم على emergency سيناريو او very critical سيناريو اللي هي زي الكوفيد 19 وان احنا بنعرض نفسنا لاخطار، فكلما قللنا البروسيسز دي او النون فاليو ادد او الحتت اللي ملهاش اهميه في البروسيس، فاحنا بنقلل الاكسبوجر وبنقلل على نفسنا الريسك بالنسبه للبيشنتس او بالنسبه للستاف. فيعني ايه تولز، في تولز ثانيه احنا اتكلمنا عنها النهارده بس عشان انا ما كنتش نسيت حاجه.
Just in time.
جو اهي يا احمد، جو اهي.
Just in time دي تول بنتكلم فيها عن وجود كل ما يستلزم، كل المستلزمات اللي هتحتاجها عند الاحتياج، بالظبط عند لحظه الاحتياج. فكنا بنتكلم عن نماذج لكده، مثلا انه يكون عندك بتحط كل المستلزمات الخاصه بالحمايه زي الجلافز، القفازات، الماسك كده، بتحطها at the point في النقطه اللي انت داخل فيها عند المريض، عند باب المريض، بحيث ان انت ما تقعدش تدور عليها كتير. اتكلمنا عن وجود مثلا خطوط اتصال مخصوصه للاجابه عن استفسارات الكوفيد 19 او للتعرف على المرضى الكوفيد 19 بشكل اسرع. اتكلمنا عن وجود نماذج لجداول للاطباء اللي هم تحت الاستدعاء، بس في حاله انه حصل عدد كبير من المرضى جم مره واحده، عائله جت مع بعض عشان تكشف عندهم اعراض الكوفيد 19، فانت تقدر ان انت تتصل بالاطباء دول بسرعه يكونوا عندك عشان يقدموا النصيحه الطبيه المطلوبه في الوقت. وشكرا.
شكرا. احنا حاولنا نسمرايز، طبعا هي يعني السلايدز هتبقى موجوده في الفيديو، يعني تقدروا تتابعوا السلايدز. يمكن انا مشيت بسرعه كده من غير ما امشي على السلايدز، لكن يعني هي السلايدز فيها شرح وفيها دايجرامز ممكن تربط المواضيع بعضها معاكم. طبعا احنا مينلي ما بنشرحش اللين احنا، لان احنا بنتكلم مع كواليتي بروفيشنالز اللي هم المفروض they are trained to use اللين as much as they can، بس احنا بنحاول نوفق التول مع الكوفيد 19 او ازاي يسهل عمل التيم الاذر تيمز في الكوفيد 19. I hope that we answered all of your questions as much as we can. We will post the video for in social media, and if there is any question, Ahmed, you want to answer, or Muhammad or other colleagues?
Thank you so much. هو يعني يمكن معظم الأسئلة على البرزنتيشن نفسها والفيديو، فاحنا إن شاء الله تكون موجودة على السوشيال ميديا. برضو في طلب انها تكون موجودة على تويتر، إن شاء الله بوست on تويتر. مجرد ما ننتهي من الرفع هنبعتها، نرسلها إن شاء الله. احنا يعني موجودين سوشيال ميديا تقريبا بنفس السبيلنج اللي موجود هنا، فتقدروا حضراتكم تشوفوا أي أكونت وإن شاء الله ويل بوست. البوست في اليوتيوب بيكون على الشانل دكتور مصطفى غلوش بنفس الاسم على اليوتيوب، وإن شاء الله يكون موجود عليه.
Thank you, Dr. Ahmed. I would like to thank my colleagues, Dr. Ahmed Al-Sheikh, Dr. Mohammed Al-Fayoumi, Dr. Ahmed Al-Jamal, Dr. Islam Abu Yusuf, and Dr. Zakaria Abdelhamid also. Our team are doing like our best just to simplify some of these concepts, and we are trying again to make our quality tools viable in this COVID-19. We hope that some of tools will help you, or our slides will help you to address some of the problems you face in your organization. And we hope to get your feedback. Whenever you close this session, you will get a link for a feedback questionnaire. This will help us a lot to prepare for next sessions. We will discuss the topics according to your feedback, and we will, inshallah, again announce if we will have the next session with that topic with you. Thank you again. Thank you for your patience for some technical issues, and thank you for your attendance. See you.